Hello everyone, I am Dr. Parvez Ahmad. Today I am going to talk about the antiemetic drugs. What do I mean by antiemetic drugs? That means that these are drugs generally we have used in case of prevent or suppress the vomiting, that is called antiemetics. Okay. Before starting the antiemetics, first you understand the emesis, vomiting. Okay. We know that different type of pathways involved in a vomiting. Okay. See the first one, vestibular apparatus is very important. Vestibular apparatus contain muscarinic receptor and H1 receptor which stimulate the vomiting center and induce the vomiting. Okay. Now next one is radiation and chemotherapy, toxins. These are also stimulate the NTS and induce the vomiting. Now we know that in a pharynx and GIT 5-HT3 receptor evidently present which stimulate the NTS and finally induce the vomiting. Emotion, pain, stress which stimulate the higher center and finally induce the vomiting. Okay. So, here multiple type of the receptor involved in a stimulation of vomiting center and induce the vomiting. So, here in as antiemetic drugs we have used to antagonize the these all type of the receptors. Okay. Now, move to the antiemetics. Now, antiemetics I am already stated these are drugs we have used to suppress or prevent the vomiting. Okay. And now, first categories of antiemetics is the anticholinergic. Okay. Examples are hyoscine. Hyoscine is also called scopolamine. Okay. Now, second examples of anticholinergics are dicyclomine. Okay. Basically, hyoscine generally we have used as a prophylaxis in case of motion sickness. Generally, we have advised to the patient these are drugs take half an hour before the starting the journey. Once a vomiting starts, this drug is not effective. Okay. Now, second category of antiemetics are very important, prokinetics. These are the clear from the name, these are drugs which increase the gastrointestinal motility. Okay. These are drugs which increase the Elias tone and increase the peristalsis movement. Okay. Now, examples are domperidone. Next one, metoclopramide. Next one, cisapride. Next one, levosulfuride. Okay. So, these all are the examples of prokinetics. Now, domperidone, levosulfuride nowadays we have used along with the pantoprazole in case of the GERD and gastritis like condition. Now, third class of antiemetics are neuroleptics, and neuroleptics is also called D2 blockers. Okay. Examples are chlorpromazine, Now, the next one is the fourth category, is called H1 antihistamine. Okay. Examples are promethazine, diphenhydramine, next one doxylamine, very important. Doxylamine generally we have prescribed in case of morning sickness along with the folic acid. We know that folic acid help to prevent the neuronal tube defect in newborn, that is why I have used. Now, the next category is a NK1 antagonist. Okay. Example is aprepitant. Okay. These are the newer drugs. Now, the last category is the adjuvant antiemetics. Adjuvant antiemetics. Examples are benzodiazepines like diazepam, next dexamethasone and cannabinoids. Okay. So, these all are the adjuvant antiemetics, example of adjuvant antiemetics, and these are drugs we have used along with the main category of antiemetics. Now, seventh one is the most important one, is the 5-HT3 antagonist. Okay. We know that 5-HT3 receptor generally stimulated by the chemotherapy. Okay. So, these categories of the drugs we have used in case of chemotherapy induced vomiting. Examples are ondansetron, granisetron. Okay. So, these all are the examples of antiemetic drugs. Okay. Other details like mechanism of action, side effects we have discussed in my next video. Thank you.